Welcome back everyone, I'm Rachel and you're listening to Conversations with Dental Friends, the go-to dental podcast for dental professionals craving more from their careers and who are eager to discover how to get there through inspiring stories. Today I'm thrilled to have a chat with my wonderful friend Shelley Dawson, a treatment coordinator at Helen By Dental Practice. If you're curious about moving into treatment coordination or want to see how this role can transform your practice and even dive into some top-notch training and connect with a vibrant community, this episode is packed with insights for you. But just before we dive in, a quick favour, please hit that follow button. It really helps podcasts grow and it means more inspiring conversations delivered hassle-free right to your phone. All right, let's get into everything treatment coordination with the lovely Shelley. This podcast is sponsored by Dental, a company that's been setting the standard in dental innovation for over 80 years. Whether it's their ultra-reliable suction systems, world-class hygiene solutions, or cutting-edge dental imaging technology, Dental supports dental professionals who take their craft seriously. Check them out at durdental.com because excellence starts with the tools you trust. And of course, a huge congratulations to Oratol celebrating 60 incredible years this year. Happy birthday, Oratol. Here's to many more years of innovation and excellence. I truly couldn't imagine the dental industry without you. So happy birthday from Conversations with Dental Friends. Welcome Shelley to Conversations with Dental Friends. Thank you so much for being part of my podcast project today. And here we are in season 2, so it's really fab to be recording with you today. And I'm so delighted to have Shelley on because not only is she an awesome friend, but she is an awesome part of the dental team. Shelley, you've worn so many hats within dentistry over the years. Can you take us back to where it all began? How did you first get into the profession and what has your journey looked like since then?
Well, a career in dentistry was always at the back of my mind.
Okay.
But I hadn't fully committed to the idea until 2013.
Right.
When I had just moved to Moira and I spotted a job advert as a trainee dental nurse in Moira Cosmetic Dental. And I went for it. And honestly, from my first week, I felt like this unexpected passion ignite
Joy
for teeth.
Yeah, Derek.
Yes. But it wasn't just about the teeth. It was about the people. It was about getting to know the patients, learning about the variety of treatment options, especially in a private practice.
Because it's so different, private practice, isn't it? From I certainly, before I started working in private practice, I would have went to an NHS dentist.
Yeah.
So that is like a whole new world, isn't it?
It absolutely is. And it makes it all so much more interesting and much more interesting than I ever would have imagined it to be.
Yes.
So once I qualified as a dental nurse, I didn't just stop there. I went on to complete courses in impression taking, implant nursing and radiography, and all of that keeps everything so fresh and exciting on a day-to-day basis. So I stayed in Moira Cosmetic Dental for around 7 years.
It was a good 7 years.
It was. I absolutely loved it. I loved the ethos of the practice, the high standards of care, but most of all, some of the people that I worked with who will be lifelong friends.
Yes, for sure.
You included.
For sure.
But then after having my second child and facing a longer commute, I decided that I needed to be somewhere a wee bit closer to home.
I feel you, girl.
Yeah. And you just need to look at the bigger picture. And
Sure.
That brought me to where I am now in Helen By Dental Practice. So it's also a fully private practice offering high quality care and advanced treatments like, again, dental implants. But thanks to all the experience that I gained at Moira, especially working closely with implant patients, I was able to smoothly transition into my treatment role now as a treatment coordinator. It felt like a natural next step and I just love it as much as I did when I walked through the doors in Moira all those years ago.
Absolutely. You love it every single day. And dentistry is one of those things where everything's very repetitive, but every day is different in its own way. And that's one of the things that I really enjoy about it. Shelley, you're currently working in treatment coordination, as you mentioned, an ideal person in my mind to be a treatment coordinator, which aside from hygiene, it is one of my favourite roles within practice. I think if I wasn't a dental hygienist and I had explored dentistry in a different way, I also would have really liked to look at treatment coordination for a job or as my role. Can you break down for us what treatment coordination actually involves and what drew you to it in the first place?
I'm so glad you love the role because I think it's such an underrated gem in dentistry.
It is.
At its core, treatment coordination is all about being the bridge between the clinical team and the patient. It's my job to guide patients through their treatment journey from the very first consultation right through to completing their care.
Yeah.
Which can include going over treatment options in a way that's easier for them to understand, help them with scheduling, breaking down costs and payment plans, and just being that constant friendly point of contact throughout.
It feels like a bit like the practice concierge.
Yes.
In a way.
That's exactly what it is.
I'm just thinking about now Home Alone 2 and that guy saying, we're the concierge. But it's something that a patient really values, I think, because who else do you speak to? And you do have, people have a lot of questions.
I know, well, that's thanks to Google, don't they? And they're going home and they're Googling things. And they're like, flip, I should have asked that, should have asked that. And they can't just phone up and ask to speak to the clinician. You know, everyone's busy with patients. So you are that person. It's such a people-focused role, and that's what really drew me to it. I love building the relationships with the patients, helping them feel informed, empowered and comfortable about their decisions. I think that's what really pulled me in was the experience in having the assisting with the implants and more complex dental cases over the years. I've seen firsthand how important clear communication and patient support is when someone's considering more advanced treatments. So stepping into that role where I could bring all that clinical knowledge together with the human side of dentistry, it felt like the perfect fit for me.
Absolutely.
It's a role that lets me use everything I've learned while constantly growing, and no 2 days are ever the same.
No
I just
2
love
days
it.
are the same. And they are big decisions. Whenever you think about if you were in the patient's shoes, first of all, you're taking on a big decision mentally because this is something that's going to be massively impactful on your life. It is like going in for surgery. It is the equivalent of doing that. It takes a lot of your time and it's expensive. And there will be, of course, I know that you'll have gone through all the different personality types of patients, but for me as a patient, I want to know everything. The more information you can give me, the better. I think that I would love to have a treatment coordinator accompany me through most of my life decisions. if I could have
I'm
that
always
support.
available.
A lot of practices, Shelley, are probably already doing elements of treatment coordination. Everybody does it. I even do it in my dental surgery. Sit the patient up. Maybe if the patient has periodontal disease, we'll go through some options and what they might look like. So they're maybe doing some element of treatment coordination without even realising. But from your perspective, what are the real benefits of a practice investing in that dedicated TCO role? And what kind of support or training do you think helps that role thrive in practice?
It's a really great point. So many practices are already doing bits of treatment coordination, if you said, you know, whether it's a receptionist answering detailed questions or a nurse helping explain chairside options. But the real magic happens when you have a dedicated TCO in place because, you know, that role gives you the time and focus, you know, that it truly deserves. The biggest benefit is definitely patient experience. When patients feel heard, supported and fully informed, you know, they're far more likely to commit to their treatment. And more importantly, they would feel good about it.
They're not rushed as well. I like that.
Yeah.
Because you don't mean to rush a patient. You never mean to rush a patient. But every time that you have a patient in, it gets to, your patient's in at 2:30, gets to 2:50, the little bing bong happens. Your next person's in the waiting room and you maybe can't fully go through things how the patient would like to, and there is always the option, as you say, of speaking to the clinician, but that is something that would need to be built into a diary. So to have a dedicated person for that, I think is wonderful.
Well, the TCO builds trust and give patients space to ask questions without clinical pressure. It ensures nothing gets lost in translation between appointments. From a practice perspective, it also helps streamline things massively. Clinicians can focus on the clinical work, where the TCO can handle communication, coordination and follow-ups. It increases treatment uptake, reduces cancellations, and it all keeps the day running a lot smoother. As for the training and support, I think one of the best things a practice can do is invest in communication skills, especially around presenting treatment options and handling objections with empathy. It's what people need. A strong foundation in clinical knowledge obviously helps too. Things like implant or ortho, things like that. So the TCO needs to be able to confidently answer those questions. But more than anything, it's about having the time, as you've said, and the trust of the team to let you be able to do that role. When that's in place, the TCO can absolutely thrive and become a key part of the patient journey.
And it's not all smooth sailing, as you said.
No.
There are difficult questions that you need to answer, and I think that communication is such a key takeaway, and having that communication training, because everybody thinks, oh, I know how to communicate. I communicate every day of my life. But it's hard to, you basically want something that is replicable for different scenarios, that makes the patient feel heard, makes the patient feel understood, is caring and empathetic, as you said, but also moves the needle. And that's, you don't want somebody to be in limbo.
Yeah.
As much as with TCO, there isn't a hard sell, but you are trying to get the patient to make a decision, and it doesn't really matter what decision is made.
Yeah.
You just don't want that option or those options for the patient to disappear into the ether. You want to move forward for that person, to ultimately get them to their goals. And I think the treatment coordinator is brilliant at that. Shelley, like many roles in dentistry, being a treatment coordinator can feel rewarding, really rewarding, but also isolating at times, because very often you're going to be the only TCO in practice. Any practice I've worked with a TCO in, there usually only is one, although we did work with two at a time in Moira, but there usually only is one. Have you found any networks or communities online or otherwise that help you feel more connected or inspired in the role?
Well, it can feel isolating at times, especially as the TCO role sits in sort of a unique space between the clinical and admin, but I am very lucky. Yeah. I'm not the only TCO in my practice.
Oh, that's good.
There are actually 3 of us.
No way.
There is, yes. Glenda is one of my colleagues and has been a TCO at Helen By for many, many years. I think she might have actually been one of the first TCOs in Northern Ireland in a dental practice. TCO. Yeah. She's incredible support to me, and I lean on her quite regularly, whether it's for advice or a second opinion, or even just to bounce around new ideas. It's that kind of internal support is invaluable. Outside of the practice, I did Marcus White's a course with his TCO team a few years ago.
I'll make sure to put that in the show notes for everybody.
Yeah,
that's brilliant.
And they were amazing. They brought loads of fresh ideas and perspectives to the role. Things I hadn't considered before. It really helped me grow and see the bigger picture of what a TCO can bring to the practice.
Yes.
Also, everyone knows Laura Horton. Follow her on Instagram.
Absolutely.
She's really great practical advice, and she champions the TCO role in a really relatable way.
100%. I think Laura Horton has a podcast with another TCO that she works with, Leanna, who a brilliant TCO. I'll link all of their Instagrams, of course, as well, but it is great. They have that. Instagram now is such a brilliant online community for every dental role, I think.
It really is. And all of these connections in person and online have played a big part in shaping how I work and helped me feel part of a wider community.
Yes.
So I definitely say, if you're in the role and feeling a bit isolated, seek out those voices of people. There's so much inspiration and support out there once you know where to look.
There is, exactly. It's just being signposted to the right places. And of course there's all of those brilliant courses around practice management. Chris Barrow, is it Chris Barrow? Chris Barrow.
Coach Barrow, yeah.
Coach Barrow. There are definitely areas that you can find that kind of support. And LinkedIn, I think, is brilliant as well, because people now are using LinkedIn, I suppose, a bit like a blog. So you'll have people put like massive posts up and you can check in with them, and it might be different little tips or tricks or even just that support that we all really need in our roles. Alongside your work with treatment coordination, you've also built a really strong foundation in nursing and also implant nursing. I always think of you as just like the best implant nurse ever. Can you talk us through what implant nursing involves, how it differs from general dental nursing, and the kind of training you pursue to elevate your role in practice?
Well, implant nursing was a huge part of my journey in dentistry and something I was really passionate about. It's definitely a step up from general dental nursing. Not necessarily in difficulty, but the level of precision and planning and teamwork involved.
To be so organised, and there's usually 2, isn't there?
There is, yes. With general nursing, you're supporting a day-to-day procedures, checkups, fillings and hygiene visits. But with implant nursing, you're stepping into more surgical territory. You're assisting in more complex procedures, managing sterile protocols, prepping surgical kit, and often coordinating care with labs or referring dentists.
It does look very different to the patient. I suppose maybe not now after COVID, all the patients have been exposed to the twilight zone of dentistry where everybody is like gowned up, but you are assisting with a surgery. That's exactly what it is. This episode is sponsored by Lighthouse Dental Company, your partner in creating beautiful, functional dental practices. From equipment supply and servicing to full refurbishments, including flooring, cabinetry, electronics and plumbing, they manage the entire project so that dentists can focus on what matters first, their patients. You can explore how they bring practices to life at lighthousedentalcompany.com. And you do have is it a clean nurse and a dirty nurse?
Yes,
is that right? And you will each have your role. Do you alternate? Does one person do one and one person do the other?
One does the other.
Were you always a certain role in the procedure?
In my old practice, I would have been the clean nurse most of the time. But in my new practice in Helen's Bay, I'm mostly the second nurse just coming in.
So what does the clean nurse do then? They're actually
doing
the
the
procedure
nursing with the clinician. Where your dirty nurse is the one who's getting out what implants they require.
Okay.
You know, if they happen to need something, you're the one who's able to nip out and get it, whereas they can't leave the surgery there.
So you're like the sous chef.
The head chef, yes. But there's a lot more planning before the patient even gets in the chair, and a lot more following up afterwards as well. I first got into implant nursing in Moira Cosmetic alongside Derek Bingham, who had a wealth of experience in implants.
Loves dental implant.
He does. I was lucky enough to be exposed to it earlier on in my career, and that experience was really hands-on and laid the groundwork for my confidence to do with implants. And to build on that, I went to and completed a specific implant nurse training alongside my impression taking and the radiography qualifications. But that extra knowledge really helped me understand the full scope of the treatment.
Yes.
Not just from a nursing point of view, but from the patient's perspective as well. And how, now in my TCO role, it gives me a huge advantage when it comes to explaining the process, answering questions and supporting patients who are considering the treatment. It's one of those areas where the more you learn, the more rewarding it becomes. You know, I'll definitely encourage any nurse who's considering implant treatment, nursing training, to get stuck in and explore it. It opens up so many doors.
Yeah. You guys went to England to do that, didn't you?
We did, yes.
What was that course? Do you know the name of that course?
I can't remember what it was.
I'll find out and I'll pop it into the...
It was Coventry we flew to. Yes. I remember it was in Coventry. I'm trying to even remember the name of the practice or the...
Did you meet Chris Tarrant there? Is that where you get...
That's how I met Chris Tarrant. Natasha, and I was like, oh my goodness, there he is. I wasn't going to say anything, and Natasha went down, can my friend get a selfie, and put his arm around me like we'd do each other for years.
Yes, I remember vividly getting the selfie through to the practice WhatsApp group of you and Chris Tarrant. I think that really is something that the practice supports you with. Implant nursing, it's not really like oral health education or, well, I suppose impression taking. You can pursue that yourself as a dental nurse, or your practice can support you with that. But if you want to go into dental implant nursing, you want to know that your practice is doing dental implants.
Absolutely.
And it is a massive undertaking to take on financially, I think, without the support of your practice. Although I know a lot of practices will kind of have agreements in place where they'll maybe support you and contribute to your education financially around dental implant nursing, but then you're wedded to them for a certain amount of time post qualification. So I think it's a really brilliant role, and I don't really think now, if you were a dentist and you wanted to do dental implants, that you could do it without an implant trained dental nurse, because it really is just so...
It's so
in
specific,
depth.
yes, and you need someone who
And
understands what's
yes.
going on. You know, your nurse needs to be able to almost anticipate what you're going to need. It needs to run really, really smoothly.
Because it's stressful for the dentist. It's a different environment for the patient, although I know a lot of patients are sedated to go through that. But even the sedation side of it, to have that awareness too is brilliant. But it's something that I would feel more prepared as a clinician if I was doing something like that, knowing that I've went through my, obviously, additional training, and then whoever's assisting me has went through that additional training as well. So I think that's really important. Shelley, we're definitely at a bit of a turning point in dentistry, especially when it comes to retention of dental nurses. It's a really hot topic at the minute. I know that there are lots of open job roles here in Northern Ireland and around the rest of the UK and Ireland looking for dental nurses. And a good dental nurse is hard to come by. What, in your view, makes an outstanding dental nurse, and how can practices create an environment where nurses feel empowered and valued and able to really grow within their roles?
Well, you're completely right. You know, we are at a bit of a crossroads. I think it's really important. It's a really important time to start recognising how vital dental nurses are.
Absolutely.
You know, not just support staff, but skilled professionals in their own right. You know,
So skilled.
For me, an outstanding dental nurse is someone who's proactive, adaptable, and genuinely cares about both the patient and the whole team. It's not just about clinical knowledge, although it's important. It's about being that calming presence in the room, the organiser behind the scenes, and often the glue that holds the day together. A great nurse anticipates the need of a dentist, the patient and the practice all at once.
Yes.
But to really thrive, nurses need to have the right environment. You know, that means being valued, and you don't just need a pat on the back. You know, being included in team decisions and having access to further training, being encouraged to take on extended duties and acknowledging their contribution. And you need to be seen and you need to be appreciated. And, you know, a simple thank you does go a long way.
Yes.
But so does giving nurses a voice and a career path.
Compensated financially as well. You know, you need to...
Absolutely.
I do think that it is important to be fairly compensating whoever's assisting you, because they work so hard.
Yeah. When I think back on my own journey, I've stayed in this profession and continued to grow because I've always been in a practice where I felt supported and trusted and been given opportunities to develop, whether that's the implant nursing, the radiography, or now as a TCO. Practices that invest in their nurses will not only retain them, but will see their whole team thrive as a result. So it comes down to the culture where nurses are feeling empowered and respected. The energy shifts, that benefits everyone, especially the patients.
I think it's important to be positive as a practice, and as you say, to really show how valued the dental nursing team is, and give them opportunities, because it's a repetitive job. Shelley, for anyone listening who's thinking about stepping into a treatment coordinator role, or even just pivoting within dentistry, what advice would you give them? Were there any challenges you faced during that transition, and how did you navigate them?
I would tell them to absolutely go for it. The great thing about dentistry is that it's full of opportunities beyond traditional roles. So, the TCO position is such a rewarding next step up for anyone who loves patient care and wants to make a real impact. That said, it's definitely a shift. One of the biggest challenges I faced was moving away from being fully clinical.
Yes.
I was so used to being hands-on in the surgery, assisting with the treatment. It felt strange at first to take a step back and focus more on communication. There probably was a bit of imposter syndrome too. Am I really the right person for this kind of feeling? But I navigated it by leaning into the people around me, especially Glenda, as I mentioned before, the other treatment coordinator, who has been doing TCO role, as I said, already in Helen's Bay for many years, and continuing to invest in learning, by doing the courses with Marcus White and his TCO team.
Yes.
All those wee things really give you a confidence boost.
Yeah.
And it showed me that there's no one size fits all
No.
to be a TCO. You have your own strengths that will make the role work. My biggest piece of advice is just back yourself. Your clinical experience is so valuable, but your people skills are just as important, maybe even more so in a TCO role. Keep up with your learning, keep asking questions, and surround yourself with people who lift you up. Growth doesn't happen overnight, but with the right support and the right mindset, it's so worth it.
Yeah, so much of it is mindset and knowing that there's more in this life for me. I think generally to know that, but also within your role at work. So did you come into Helen's Bay as a nurse and then move into treatment coordination? Or yes?
Yes, I did. Yes.
So how did you find going from a nurse as your dynamic within the team? How did you find going from being like a nurse to moving into a TCO?
Whenever I first started in Helen's Bay, my mindset was just straight in there, let's get to nursing. And obviously they recognised something in me.
Yes.
They thought, she likes to talk. She's a good chatter. Let's get her into TCO.
Professional yapper?
Yeah, the professional yapper. But again, going back to Glenda and the support, and she has been really there for me in Helen's Bay. She really helped me boost my confidence in that role, which I probably needed because I was so used to doing the surgery side of things.
Yeah.
But it's probably, as much as I love the hands-on nursing and the implants and being in surgery and being so organised and helping the dentist, I feel like my TCO role is probably my favourite role that I've been doing so far.
I love that.
Love getting to know the people. I love chatting to them whenever they come in and seeing their end result. That is what it's all about. It completely changes people's lives. I don't think people realise how much until they get certain treatments done.
They don't.
Their facial expression is just so different. You can't stop. They're smiling. They're telling all their friends. They're telling all their family. And it's an incredible part of the job.
And it's quite honestly, I was actually speaking to a patient about this the other day, and they were back and forward about going through ortho treatment. And I was explaining to the patient that I had ortho treatment with Dr. Murray Smith, who works there. And I loved that, shout out to Dr. Murray, he did a great job. We looked at doing that kind of from a patient perspective where I would be, and I think that happened whenever you did your ortho as well. It was there for patients to ask us questions. And then COVID happened and I was wearing an FFP3 mask and nobody knew what I looked like, let alone that I had Invisalign on. But that was the best thing that I have ever done for myself as a person. You can buy as many pairs of shoes as you want. You can buy as many new outfits. But having that confidence with my smile, because I had some relapse after a previous ortho as a teenager, but having that confidence in my smile, I just thought, why didn't I do this sooner? Why didn't I do this whenever I was getting married or for my 30th birthday or something like that? It felt like something that was really not on my radar, had such a big impact. And I now always really think about that for the patient, because you don't realise how big that's going to be for you to have that kind of treatment. So I really love that. I love that. And finally, what's next for you, Shelley? Are there any projects, goals or new directions on the horizon you're excited about, either personally or professionally?
Well, honestly, I think I'm just in my happy place right now, and I don't take that for granted.
No.
I'm working in a fantastic practice that's got a fully digital workflow, state-of-the-art equipment, and a brilliant team, and we've probably never been busier, which is a great sign that we're doing something right.
Yeah.
Outside of work, I'm also a busy mum of two, so life is full on, but in the best possible way. there's lots of juggling, but lots of laughs and not a lot of quiet time.
No.
But I wouldn't change it.
No.
As for the future, I think the beauty of dentistry is that the sky's the limit. You know, the field is evolving so fast with new technologies, digital advancements. It's exciting to think about what might be possible even in a year or two from now. I'm definitely keeping an open mind. Who knows what direction things might take next. I just know that I want to keep growing and keep learning and staying in the heart of patient care, wherever that leads.
Absolutely. I love that. And do you do the social media for Helen's Way?
I do.
You do the social media. How do you find doing the social media?
I love it.
Yeah.
I really, really love it. And I would love to have the time to focus a lot more on that, but we are just so busy at the minute with new patients and the treatment coordinator role, and even nipping into surgery to nurse whenever they need me. That is taking up the bulk of my time at the minute, but hopefully when things start to even out a wee bit more, I would love to spend more time on doing this media side.
You're brilliant at social media. Aren't you? You also do a little, can we say you do a little bit of social media for Roma's restaurant in Newton?
I do.
If anybody hasn't checked out Roma's yet, you need to. It's fab. And
all the Ashland Bangor as well, the Ashland restaurant, it's the other one.
And all the social media is Shelley, so you can give her a like and give Shelley some support. And if you're interested in finding out a little bit more about treatment coordination, I'll of course be leaving lots and lots of links for everybody down below.
And if anyone listens to this and thinks they have more questions for me that maybe I haven't answered today, they are more than welcome to send me a wee message on Instagram.
That would be great. What's your Instagram?
It's a good question.
Yeah.
Let me see.
Is it at Shelley D?
Shelley D 1986.
Shelley D 1986. Come on for us. And I'll tag you in the show notes as well. That would be great, Shelley, because it is good for somebody. I think this is really beneficial for somebody who maybe is a dental nurse who wants to expand their role, but also maybe for a practice owner, practice manager, practice principal that feels like they would really now at this point, as we're mentioning, dentistry is getting busier and busier, they might want to lean into that treatment coordination role and open up that space in their practice. And I think that would be brilliant for any new practice owner to do that as well. So that's brilliant. Thank you so much, Shelley, for being part of our podcast today. I've been delighted to have you on and I really appreciate it.
Thank you so much for having me.
Oh, you're welcome.
That was a different Saturday morning. I loved every second of it.
Thank you. Thanks, Shelley. That was just such a brilliant conversation. A huge thank you to Shelley for sharing so openly and giving us a real insight into treatment coordination and everything it can bring to a dental practice. I especially loved hearing about her journey into implant nursing and how that experience ties so beautifully into that TCO role. If you're someone thinking about expanding your skills or stepping into a more patient-focused position, I hope this episode gave you that little spark to explore what's possible. If you want to keep up with Shelley or have any questions about the amazing work she's doing in the TCO role, give her a follow on Instagram at ShelleyD, ShelleyD 1986. And if you're not already, come hang out with us at Conversations with Dental Friends. I'm over at Homegirl Hygienist. If you want to, say hi, share your thoughts on the episode, and let me know if there's a topic or guest you'd love to hear next. And it would honestly mean the world if you could hit follow and leave a quick rating or review and share this episode with a dental friend who might be curious about treatment coordination or just needs a little boost of inspiration. Thanks for being here. I'll see you next week for another episode of Conversations with Dental Friends.